Hi everyone, I'm Alex. I'm a nurse practitioner here in Florida, Largo, Florida. I work with Dr. Young and I work mainly with women. So that means that I deal with a lot of hormones, a lot of hormone replacement therapy, with a lot of thyroid issues with my ladies. But one of the questions that I get all the time that I would like to answer to you guys today is, Alex, why would I do hormone replacement therapy? What are the benefits of hormone replacement therapy? Now, we're talking about hormone replacement therapy for those women that are going through menopause or they're already postmenopausal. And they ask me this question because usually the information that they get is that hormone replacement, it's bad for you because estrogen is bad for you. It can cause blood clots. It can give you hypertension. It can give you a heart attack. So they want to know what's the difference, what am I doing different? So when I say hormone replacement, I'm not talking about synthetic hormone replacement. What we do is bioidentical hormones. What does that mean? That means that I'm using the most identical natural form of hormone out there to help your body to feel you optimal. So the intention of the bioidentical hormones is really to improve your quality of life. We're not trying to restart your period. We're not trying to make miracles here. But a lot of women come to our practice asking for little things. They just want to sleep better. They have hot flashes. They have dry skin. They have hair loss. They are feeling super tired. They are not losing weight. So we're just trying to improve your quality of life with those hormones. So I will determine who needs and who will benefit with bioidentical hormones. This is just to say that not everybody will see the benefits right away, and not everyone will 100% benefit from hormone replacement therapy. So therefore, I have to be able to sit down with my patient and we have to talk about it, and we both have to make a decision if we want to do hormone replacement and why do we want to do hormone replacement therapy. Now, one of the very common questions that I get about this is, wait a second, if I want to do hormone replacement, isn't that bad for me? I say no. And the reason why I say that is because we have a study, the Women's Health Initiative study, that it shows that synthetic hormones are bad for you, and they are correct. Because those are hormones that you take orally, and you have several metabolites. Once you take the pill, it goes through your liver, and now you have metabolites that can be bad for you. That's not what we're doing. We actually use this study that we'll call the French cohort study. Those are the French women that they did hormone replacement therapy. So what they did was they compared a group of women that did nothing with a group of women that did bioidentical hormone replacement therapy. And their results shows that women that did hormone replacement therapy by bioidentical hormone, they actually had better outcomes, meaning they had better blood pressure levels, they had better cholesterol levels, they felt better. The thyroid function was improved. And the women that did nothing, no hormone replacement whatsoever, they actually did worse. So we have to determine what patients benefit from that. The other thing that I like to explain to everyone is that in our practice, we don't just do hormone replacement therapy. We do other things. Therefore, I have to look at your blood work in a very specific sense, because I need to give you the hormones, but I need to make sure that your body can tolerate and metabolize your hormones properly. So your liver function needs to be good, because once you get estrogen in your body, you need to be able to metabolize your hormones that I'm giving to you. So I am looking at your chemistry. I am looking at your blood sugar. I'm looking at your insulin. I'm addressing your diet. I am not just throwing hormones at you and waiting for one day for you to feel better. No, we're going to address you as a whole person. This is a holistic practice. Dr. Young is a medical doctor. I am a nurse practitioner. We do practice integrative medicine, and we do use bioidentical hormones as a tool to improve patients' quality of life. However, it's not the magic bullet. I don't want everybody to think that they're going to do hormones and everything is going to be great. It's part of the treatment. And we have to really, sometimes it is. Sometimes I have women that come in here and they've been doing the hormones for a few weeks, sometimes a month, and they come in and they feel better. They start to sleep better because they have less night sweats, they have less hot flashes, and life is good. So it's great when that happens, but it's not always the case. So you really have to sit down with your doctor, have a conversation, and both of us have to make a decision what's better for you. But I'm very happy to make this video to clarify some of these questions for you guys.